I would like now, I would be very proud to welcome to the podium Melissa Redmond, who's going to talk to us about her recent experience of opting in to play a constructive role in challenging us to improve the safety and quality of care by being a patient safety champion. Thank you very much.
Good afternoon. My name is Melissa Redmond and I am a member of the newly formed Patients for Patient Safety Ireland. We are a group of volunteers with one aim in common, and that is to promote patient safety in our healthcare system in Ireland. We are a group made up of patients and family members who have experienced harm in our healthcare system, as well as patient advocates, policy makers and healthcare workers. Each of our members have a story to tell. Tragically, some of our members have lost loved ones through preventable harm in our hospitals. Some of our members have pulled through adverse illness caused by a lack of patient safety in our hospitals. Some of our members have witnessed harm done to their loved ones in our hospitals. It is our intention going forward to promote patient safety in all aspects of healthcare in Ireland. We hope to have the opportunity to combine our knowledge, the difficulties we faced, the insights and the learning gained from our individual experiences, and to use all of that in collaborative partnership with healthcare in order to produce improvement and ultimately to arrive at a better way of doing things. Patients for Patient Safety Ireland emphasises the central role patients can play in improving patient safety. It was through my own experience that I felt the need to highlight the difficulties faced by patients attending our healthcare system today. This group has given me the means to put into practice all that I have learned in my journey for answers. I want to use my experience to help other people and also to empower them to be proactive in their own healthcare and to drive their own recovery. I aim to educate policymakers, management, healthcare workers, from the most senior to the most junior, to the importance of patient engagement, to an awareness of the patient perspective, to listen to them, to identify their concerns, to communicate effectively with them and their loved ones, to remember the patient in every aspect of the care they give, and most importantly, to learn from their mistakes. As patients in 21st century Ireland, we are entitled to the very best of care. My significant journey began on the 22nd of July 2009 when I attended the early pregnancy unit of my local hospital for an 8-week scan, which I requested due to a history of early miscarriages. I presented myself feeling well and showing all the signs of a pregnancy progressing well. After a very quick internal scan, I was shocked to be told by the doctor that I had miscarried. I protested to the midwife in attendance, but she told me that I would still be able to feel the signs of pregnancy up to 7 days after a miscarriage. I had no pain and no bleeding like in my previous 4 miscarriages, so I was devastated by this news. My options were discussed with me, and I made the painful decision to have a D&C. The first available slot was for 2 days' time. I was given the drug Cytotec, which I was to take at home on the morning of the D&C, to open the neck of my womb and help it contract. The day before the scheduled D&C, I decided that I would call to see my local GP in the village, as he had a scanning machine in his office. I explained what the hospital had told me and that my body was telling me something different. When I had the scan, I saw instantly a very rapid pulse where my baby's heartbeat should be. He flipped a switch on the machine and my baby's heartbeat filled the room. It was the most glorious sound I have ever heard. This was a few hours before I was due to take the Cytotec drug, which was to end my baby's life. In January 2010, I received a report of the internal review. There were 8 recommendations. Whilst reading my report, I found it bizarre that the subject matter of these recommendations was not already in place in my local hospital. I started to wonder if this was the same in all our maternity hospitals in Ireland. I had legitimate questions. Why are there no guidelines in place to deal with early pregnancy complications? How can it be up to one doctor on the day you present yourself to decide the fate of your unborn child? I decided that in order to ensure that these recommendations were implemented in all our maternity hospitals, I would need to go public with my story. I contacted the Irish Independent. I explained that I wanted to advise all pregnant women to trust their instincts. I wanted them to know my story so that it wouldn't happen again. I wanted guidelines put in place across the board to ensure it never happened again. Following my newspaper interview, I went on radio and TV to tell my story and what I was hoping to achieve. Going public is not easy, but I was passionate about the need for change and greater safety for the unborn. The positive effect was that a flood of women contacted the media to tell of their own experiences, each within different hospitals in Ireland. The combination of media attention and the apparent scale of the problem made it incumbent on the HSE to instigate an investigation into all suspected miscarriage misdiagnosis cases over the last 5 years, in an attempt to uncover the true scale of what was perceived by the public as a growing terminated pregnancy scandal. The review would focus specifically on women who were recommended drugs or surgical treatment to remove what was in reality a perfectly healthy fetus. 24 women were deemed to meet the inclusion criteria and were included in the review. I was very shocked. Never did I realise how many women were affected by this and wondered why it was allowed to continue. When an adverse event has occurred, or where a possible adverse incident is identified through the complaints process, hospitals are required to notify the clinical indemnity scheme. Had this happened in these cases? If so, why were lessons not learned in the aftermath of the first identified event? And why was change not put in place to prevent recurrence? For me, it brought into question the operation and completeness of a robust reporting and learning system. Going forward, the positive outcome meant that on the 19th of April 2011, the results of the National Miscarriage Misdiagnosis Review was issued. Since its publication, the HSE has been implementing its recommendations through the clinical care programme in obstetrics and gynaecology. The implementation of the report's recommendations will ensure that there are measures in place to prevent recurrence of a misdiagnosis of miscarriage. National guidelines on the management of miscarriage in the first trimester has been developed, in addition to educational programmes which have been developed for all disciplines. The Irish Maternity Early Warning System has also been successfully implemented in all our maternity units since April 2nd, 2013 for pregnant women. Ireland is the first country in the world to implement a national standardised system. An educational programme for using this system has also been successfully implemented nationally. It took drive and determination from myself and my family to bring these changes about. I have no doubt that our maternity hospitals are now a safer place to attend. But most importantly, my beautiful Michael is living testament, truly living testament to the power of the patient's voice. Because of the changes that have taken place, the improvements initiated, there are many more cherished children enjoying life in the bosom of loving families. I am proud of the part my family has played in that, and I also acknowledge the improvement measures that make it less likely for an Irish mother to have to go through such lengths again to protect her unborn child. Imagine what Patients for Patient Safety Ireland, a committed and passionate group, can achieve. I am convinced that our collaboration with healthcare professionals and policymakers will improve the quality and safety of healthcare in Ireland today. We hope to break down barriers and create open, honest and transparent relationships so that all of us are working together to make the reduction of healthcare errors a basic human right. Patients for Patient Safety Ireland will mirror the World Health Organization programme, whose pledge of partnership says, "In honour of those who have died, those who have been left disabled, our loved ones today, we still strive for excellence so that all people receiving healthcare are as safe as possible, as soon as possible." This is our pledge of partnership, our patient pledge of partnership. I am honoured to have been asked to become a part of this group, and I look forward to the challenges that lie ahead. Thank you.